Hello everyone and welcome in. My name is Sophia Schultz and I will be presenting the Legal and Ethical Issues in Oncology Informatics presentation today. This presentation will discuss an education plan focused on legal and ethical issues in oncology informatics. With the rise of digital records and patient data analytics, staff must truly understand the data privacy laws, the ethical use of patient information, and compliance standards such as HIPAA. This training aims to enhance staff awareness, promote ethical decision-making, and enhance data security practices in all oncology care environments. First, we will discuss the initial assessment. Oncology informatics involves managing sensitive data, including patient records and genetic testing information. Failure to follow privacy regulations or mishandling data can lead to serious consequences, including legal action and loss of a patient's trust. Staff needs to be properly trained to identify ethical challenges, like when to share information and how to handle consent for using patient data. This education plan focuses on reducing these risks through improved awareness and compliance with staff. By the end of the training, staff will clearly understand key legal frameworks like HIPAA and their role in oncology informatics. They will learn how to recognize and resolve common ethical dilemmas, such as patient data access or inappropriate data sharing. Staff will practice real-world scenarios through case-based exercises and pass a post-training test with a score of 90% or higher. Each participant will also draft a personal compliance plan to share with the team. The training will combine live workshops, online modules, and interactive role-playing to help staff apply ethical and legal principles. Legal experts will present case studies of actual oncology-related data breaches and their outcomes for those patients. The LMS will track staff progress, deliver quizzes, and store training resources. These verified instructional methods encourage active learning and ensure that staff are prepared to handle sensitive situations in oncology informatics. The success of this program depends on strong collaboration between departments. The hospital's compliance office will provide legal expertise, while the IT team will ensure secure systems are used for the training. The LMS will manage content delivery and tracking. Peer mentors and compliance officers will hold Q&A sessions for staff who need extra support. Anonymous patient records will be used for the case studies. This will ensure privacy while teaching practical skills. The program is planned over 6 weeks. Week 1 will involve gathering input from staff and compliance officers to design realistic training scenarios. Weeks 2 and 3 will both focus on preparing and launching online content. Week 4 will host the live workshop, which will bring together nurses, compliance officers, and IT staff for scenario-based learning. Weeks 5 and 6 will measure success and refine content for future sessions. Recruitment will begin with formal email invitations and announcements during oncology staff meetings. Flyers and posters will highlight the importance of compliance and the risks of legal issues in informatics. CE credits will motivate participation, while unit managers will identify staff who need the training the most. Registration will be managed through the LMS to keep an accurate record of participants and track completion rates. Communication will involve weekly email updates, hospital intranet posts, and manager-led huddles to keep staff informed. Flyers with QR codes will allow staff to easily register for the program. The LMS will serve as the central hub for schedules, training progress, and notifications. A dedicated contact person will be available for any concerns about scheduling or technical difficulties, ensuring that all staff are kept informed and supported. If technical issues arise, recorded sessions and backup materials will ensure that no staff miss essential training. The IT team will be on standby to resolve technical challenges, while compliance officers will handle legal inquiries. Flexible scheduling will allow staff with heavy workloads to complete training on alternate dates. Makeup sessions and email summaries will be provided for anyone who cannot attend the live workshops. Training effectiveness will be evaluated using pre- and post-training quizzes, with the results being compared to measure the learning improvements. Staff performance in ethical scenarios will also be assessed. Feedback forms will collect suggestions for improvement. 3 months after training, a compliance audit will review how well the staff are applying the information into their daily practice. Adjustments will be made to strengthen future sessions based on this feedback. Thank you everyone for being here today and participating. If there are any further questions, please feel free to ask.